This is Dr. Picart. Hello and welcome to the show. The topic of today's show is on art therapy in prisons. With me is Dr Gussak, whom I would like to introduce briefly. Dr Gussak is Associate Professor and Chairperson for the Florida State University Department of Art Education and Clinical Coordinator for its art therapy program. He has been an art therapist for almost 20 years. Dr. Gussak has been conducting extensive research on the effectiveness of art therapy with prison inmates and has published and presented extensively nationally and internationally on art therapy in correctional settings. David, welcome once again to the show. David, I know this may be a difficult beginning question, but how would you concisely define what is art therapy?
In a nutshell, what it is essentially is using the art material and using art directives to work with a population, mental health, physical, emotional populations where they have a need to work through certain issues using these materials. The art therapist has an inherent understanding of which materials may be best to bring about certain responses, and so we use the art media and the art directives to really bring a way for the populations to express themselves, to also use it to focus or socialize or solve problems, also as a means to communicate. So you have the process of the art making, which allows a redirection of emotions or a redirection of energy, as well as perhaps developing a sense of self-worth. Well, you also have the end product, which is a way to communicate with somebody when words may not be available, or even they themselves don't know what's happening, but they look at the art and they see that it may uncover some information that they didn't otherwise know. American Art Therapy Association, which is the largest professional organization for the art therapists, we've been around for, it'll be 40 years this year, and there's a number of art therapists working in any type of environment, from preschool to geriatric and hospice, from psychiatric to criminal justice to forensic to medical facilities. We're at all age groups, we're at all populations, and so really it's been an amazing tool to be able to work with people therapeutically.
Why do you think art therapy is beneficial to an inmate population?
In the early 90s, there was all this literature out there about art therapy in prison, but never about art therapy in prison. It was always about art therapy that happened to take place in prison. And so we started exploring this notion as how is it beneficial? And what we realized was that it's, theoretically speaking, this is what we wrote, we believed it was beneficial in that it helps. You're talking about a population that generally any voicing of weakness or vulnerability is taken advantage of. Any type of interaction where a person talks about their own illness or any weakness is taken advantage of. It's survival of the fittest. Well, here's an opportunity to allow people who are generally weak and vulnerable, psychiatric illnesses, depression, anything that they don't have a handle on, anything they don't have control of, gives them the opportunity to express this without necessarily having to put it into words. What's more is you're dealing with a population that a majority of these people are illiterate, or some of them just don't have the ability to put things into words. And so the art allows them to work beyond that frustration of not being able to express themselves, but doing so creatively, in a manner that's not being judged. And that's what's important. I mean, these are guys, or women for that matter, who have been judged already. And here's the opportunity to allow them to express themselves in a manner that is not going to be judged good or bad. There's also, and this is a difficult one for a lot of people to understand, is that there is a tendency to be able to escape within the art making process. I mean, I know that, Kay, that you do your own work, you do your own artwork, and I know that if you've done an art piece for an hour or 2 hours or 10 hours, you realize that you thought what 5 minutes went by was actually a full day. Well, imagine that power of being able to allow inmates to escape the confines of their cell. Of course, you can't really express that in an environment where they're supposed to be reminded where they are, but it does allow them the chance to escape to a place that's safer, where they can relax, where they can get healthier. And it really is about providing them a means of refocusing, building socialization skills, getting them a chance to redirect aggressive and violent tendencies. get where they want to beat up something. Instead, they put that energy into an art piece. And that's a great deal healthier, not only for the inmates, but for the environment itself.
So what does conducting research in the prisons entail, and what have you discovered?
The reason we ended up getting involved in conducting the research in art therapy in prisons is we've always said these things. These are all theoretical. These are all based on anecdotal information, but there was nothing that was supporting it, nothing really backing it up, where we decided to determine whether or not there really was any benefits in the sessions. And we first developed a pilot study, which later led into a follow-up study and a number of ongoing studies in which we used psychometric assessments and art therapy-based assessments as pre- and post tests before the sessions begin and after the sessions begin. And the pilot study was simply to use these measurements with a group of inmates that took place took art therapy sessions, had art therapy sessions provided for them. And then all the following sessions, we started comparing those to control groups being the groups of inmates who didn't receive art therapy sessions. And what we started finding out was that art therapy has been proven quite beneficial in reducing depression in those that take place in the art therapy sessions. It helps increase socialization, increases problem solving. The very first pilot study showed an amazing tendency towards being more compliant with unit rules and being more compliant with medication and sleeping better at night and really developing strong socialization and problem solving skills. Steps very important for them being able to survive once they leave. See, what happened was, it wasn't until 2003 that the first art therapy in prisons quantitative research really started to emerge. Now, there's been studies about the benefits of art and research going back to the 80s, California Department of Corrections, the well-known Brewster study in San Jose State University, which showed that those people who took part in art sessions were able to reflect a greater decrease in recidivism or a greater reduction in incident reports. What I'm finding out is there's definitely the humanizing aspect of the art, because there's also the anecdotal information and how much the inmates really get out of this, but there's also almost a cynical quality to it, where we're saying we need to do this hard data to be able to demonstrate that this is indeed beneficial and that these benefits can translate to benefits for the state.
Dave, I'm sure you're aware that some people feel that inmate populations are locked up for a reason. Why should we care if they're receiving therapy or not?
And it's a normal response. Ironically, it's not as normal for the staff and people that work inside, because what they see is, by us providing these services, by working with the inmates, what they see is a decrease in incident reports. They see a decrease in aggression. They see an increase in productivity, because as you decrease the depression, you increase productivity, which in turn saves money. You're not spending money on medications for people. You're not wasting money because people aren't able to go into work inside the facilities. But we get a lot of this, well, they're just in there to play games. Why are we doing this for them? It benefits everybody. And granted, there are some inmates that will get out, and we want to help them, and we want to be able to make sure they stay out. So we want to work towards decreasing recidivism, which is the revolving door.
Dave, another follow-up, very curious question. Have there been instances that have made you hesitate about the effectiveness of art therapy? Have there been instances where you've thought, I don't think this is going to work in this case?
Wow. The short answer for that is yes. Absolutely. There's been many instances where, not many, where I felt like art therapy wasn't beneficial, wasn't even necessary. In some cases may have provoked some irritation or aggression. But the question that underlies that is that the art therapy or is that the art therapist? I'm not here to say that art therapy works for everybody, and I certainly don't want to give that impression that I think this is the magic cure, the panacea for everything in there. And certainly I have been on the receiving end of people getting angry at me or wanting to pick up a chair and throw it at me, and certainly I've been involved with a couple of scuffles here and there in prison. But I don't know how much of that was me as the art therapist or how much of that was the art therapy. Now, it's not it's not a rumor that some of the best art comes out of prison. I mean, they're there 7 days a week, 24 hours a day. They do art. They're highly regarded in the institution. If they can do good art, they're considered higher than most others, and they use that to barter. And so we take advantage of that. But I mean, there's some cases where it's neither good nor bad. It just is. It just means that the inmate may not be getting anything out of this. They're just there because they want to get out of a work group or they want to get out of their cell. Okay, well, that's what we'll do with them. But certainly I've had cases where there's no change and there's no difference. And is it because they're sociopathic, or is it because I just don't have the ability to reach that person? And who knows? Maybe it's a combination of both. It'd be great to figure out a way how it works for everybody. But certainly there are limitations.
And I'm afraid that's all the time we have for today, and so that brings, regrettably, to a close today's feature on art therapy in prison.